Well, my name is Dr. Stanley Lang. Welcome to this broadcast, which is on the topic of prediabetes and how to avoid diabetes. And the purpose for this is to sort of give you an insight into the progression that is the state of prediabetes. As I mentioned, my name is Stanley Lang, and I'm known as the Whole Health Doc by some people because of my approach to health and wellness, being a whole person health approach. That's health in body, mind, and spirit, which is the way that I approach most medical problems when I can. So what is prediabetes? Prediabetes is a state of being in what we call insulin resistance. It's usually precedes diabetes by many, many years, sometimes decades, where the body slowly becomes resistant to its own insulin, and eventually the body becomes unable to pump out enough insulin to keep the blood sugar normal. And so the blood sugar starts to creep up. There's sort of a no man's zone where it's elevated a little bit, but not formally diabetes, and then finally spills over into what's called the diabetes situation or diabetes condition. So the condition is completely 100% preventable with the strategies that we'll outline. The reason that I want to talk to you about it today was I saw a patient with an unusual condition, which is called acanthosis nigricans, which is a pigmentation change that happens. And one of the things that can cause that, and is kind of a hint that this pre-diabetic state is going on, is what is called insulin resistance. As insulin levels rise, in some people, it causes this pigmentation change. And so this patient that I saw came in with these symptoms, and the test that we did, which included insulin levels, confirmed that this patient was in advanced insulin resistance. So she was indeed very pre-diabetic. She's very, very far down the path of prediabetes. In other words, she's close to becoming diabetic if she doesn't make some big changes because her insulin levels were so high. So a lot of people confuse the different kinds of diabetes. So type 1 diabetes is insulin deficient. Type 2 diabetes is insulin resistant. So people who are type 2 diabetic have too much insulin, but it's just not working well. So it was easy to measure in this person that she was insulin resistant because her insulin levels were quite elevated for fasting and way too elevated after a meal. Now, what's the solution for this person if they want to prevent becoming diabetic with 100% probability? And the solution is simple. It's a very low glycemic eating plan. Now, there's a lot of low glycemic eating plans out there. The problem with most of them, frankly, is that people won't stay on them long term. So I've been teaching low glycemic eating for more than 30 years and have tried different strategies. Some of them are associated with names that you would recognize. I'm not going to name them, just to say that a lot of the more popular plans that are out there, people just won't stay on long term. So we developed a strategy that we call the modified plate, have been teaching it for more than 30 years, and have a really high success rate of people starting it, continuing, and staying on it long term. Now, the second way that you can eat very low glycemic, which is even more low glycemic, is to be on the ketogenic diet. Either approach will help you to prevent becoming diabetic. And that's because you stop eating the foods that spike the blood sugar. And by avoiding the foods that spike the blood sugar, you avoid the insulin surges that are associated with insulin resistance. So the good news is that it is simple to avoid becoming diabetic, and that is by eating low glycemic. You can avoid type 2 diabetes with 100% certainty. It's not like 99%. It's 100% certainty that you will avoid insulin-resistant diabetes if you eat a true low glycemic diet. Now, the problem is a lot of diets that are out there aren't truly low glycemic. They're cutting corners all over the place. A good example of that is Weight Watchers. It's not a true low glycemic diet. It's got some elements of low glycemic, but it's not completely low glycemic. There are too many compromises, and the person will not reverse the pre-diabetic state with 100% certainty. Some people will, many people won't. So we have access to our program that you can have a free trial of for 7 days. You can look inside and see a program that really does work 100% of the time to prevent diabetes if you follow it. We also have noticed that people develop this state because of chronic stress, and because chronic stress actually pushes the body into deepening insulin resistance. So by controlling chronic stress, this is one of the features of why our program works to prevent prediabetes becoming diabetes. Because if you don't control the stress elements, then you will not completely control all of the things that are pushing the person along this insulin resistance pathway. Now, the third area that pushes people along insulin resistance pathway is disturbance of the gut biome. So when the gut biome or the microbiome is sufficiently disturbed, that pushes a person deeper into insulin resistance also. It causes people to gain weight, even if they're eating fairly well, because their biome has been messed up. So the program that we have touches on all three of these things. Number one, how do you eat low glycemic in a way that's truly low glycemic? Number two, how do you control chronic stress? And number three, how do you get your microbiome as healthy as possible? And all of these features are critical if you want to have the best health and maximize your chances of preventing the development of diabetes, or if you are in early diabetes, to reverse it. So anything on the diabetic spectrum, which includes just being significantly overweight, can be helped with this program. So if you don't feel like you're on a good path, I encourage you to take the 7-day trial. It doesn't cost you anything to take a look, and I can guarantee you that if it feels like a good fit and you do it, it will work for you. I wish you well. Click on the link below or on the video. God bless and have a great day.